The lush Chibale National Park scenery at the edge of Kamwenge district in the western part of the country draws tourists from near and far to unwind and catch the idyllic beauty from nature guide walks and birding. Nestled among the natural wonders, however, lies villages part of Kamwenge district where the earth is believed to deliver death rather than rewards. The soils in these villages are sullied with alkaline volcanic rock minerals such as silicon and aluminium, which upon contact with the macrophages, a type of white blood cell that surrounds and kills microorganisms in the human body, into the lymphatic system, which is part of our immune system, yields irreversible rugged swelling of the lower and upper limbs. In worst-case scenarios, among women, breasts too are affected, and sometimes internal organs among both genders. The irreversible swelling, coupled with the exposure to other opportunistic infection, can weaken the immune system and lead to death. But not just that. These same villages are trapped in the vicious cycle of poverty. Soap and other detergents, which are key to the survival of patients suffering from the strain of elephantiasis, are prohibitively expensive. We visited Muchirara in Busiriba sub-county 2 days after the burial of 55-year-old Christopher Rubagire, an elder in the community and advocate against stigma for people living with his condition. His death cast a dark cloud on this community. Locals here now live in fear as the sting of death hovers over the village like an apparition. When a neighbor next door dies, another patient starts to worry they could be next as the disease has no cure yet. His daughter, Smolen Alihimbise, explains.
My father, Christopher Bernard Rubagire, got infected with elephantiasis. He suffered with the disease for 5 years. We took him to hospital several times. We were in and out of hospital until the day he passed on.
They required medication, which was too expensive for the family to afford.
There was an organization that used to give him soap to wash his legs, but we did not get any help from our local leaders or even government.
A fortnight ago, while on another assignment, we had interacted with Rubagire. He seemed upbeat and was always eager for the community to drink from his pot of wisdom. The bad news, which cast a pall on this village, trickled in on the evening of July 28th. This is what 35-year-old Medias Togumisirize, a mother of 5, 2 of whom are dead, and resident of Busiriba village, goes through.
I have been suffering from elephantiasis for 15 years. My husband also had this disease and he died in July. I have suffered so much. The pain at times is unbearable. I used to go to hospital and they would tell me that I have no disease. Sometimes my children are forced to fend for themselves food since I cannot work because of the pain.
At the nearest health facility, there's barely an effort and means to provide basic health care.
When we go to Busiriba Health Center, they tell us that there is no medicine in the clinic. The medicine is expensive. The doctors told us that the disease is from the soil. They said the soil has too much salt and that's why we are getting sick.
Our legs get swollen. When it's hot, the skin peels off. They're actually big chops of flesh, but they have since told us to wash with salt and smear with Vaseline. The pain is sometimes unbearable though. After getting this disease, my husband, with whom I have children with, has since abandoned me. He does not want to walk with me, and even on weddings, he leaves me behind. Even children look down on us. This makes me feel so uncomfortable.
At the nearest health facility, there's barely an effort and means to provide basic health care. Many of the victims are grappling with stigma.
We need help from government because our husbands don't care about us. We can't take care of our gardens anymore. The planting season is coming in, but we can't do anything because the pain is too much. If they could give us more of such shoes.
I have been suffering with elephantiasis for close to 20 years. I cannot do anything on my own. I cannot dig. I do not even have gumboots to wear. My children are suffering without any food to feed them. I'm in great pain. My prayer is if someone could come to my rescue. I need a decent house of my own also.
I got this disease while still in school. I don't feel comfortable at all. I feel my life is incomplete. People laugh at me and sometimes they avoid me. Due to self-stigma, I'm forced to withdraw.
Many of those who are stigmatized self-isolate as they fear to walk to nearby clinics. Wives have been abandoned by their husbands. Husbands with the disease feel inadequate, while children are looked at as outcasts and sent to extended relatives or drop out of school. This 15-year-old girl is a resident of Kahondo Cell, Chirumba Parish. She dropped out of school due to the stigma as fellow students always laughed at her. This is what her mother said.
She tells me that people and children point fingers at her, and that is why she is hesitant to go to school. I wish my daughter didn't have this disease. I am poor and I cannot easily access medication.
Problem of elephantiasis has caused a lot of problem here. Many people has lost their lives. They have left widows, orphans. They are most vulnerable, and no one who cares for them.
These people who have elephantiasis have stigma. They are stigmatized. They lack social support, because you imagine you reach at someone's home by 2 p.m. in the afternoon, they're already in bed. Because they fear to go to the trading center, they fear to go to seek medication at the health facility because other people will scare them away. They think that the disease is communicable.
The World Health Organization describes elephantiasis or lymphatic filariasis as a painful and profoundly disfiguring disease caused by infection with parasites classified as roundworms of the family Filariodidia that are transmitted through the bites of infected mosquitoes. Mosquito-transmitted larvae are deposited on the skin from where they can enter the body. The larvae then migrate to the lymphatic vessels where they develop into adult worms, thus continuing a cycle of transmission. In communities where filariasis is transmitted, all ages are affected. While the infection may be acquired during childhood, its visible manifestations such as limbs oedema may occur later in life, causing temporary or permanent disability. In endemic countries, lymphatic filariasis has a major social and economic impact. Elephantiasis, according to the World Health Organization, affects over 120 million people in 72 countries throughout the tropics and subtropics of Asia, Africa, the Western Pacific, and parts of the Caribbean and South America. When the disease was first flagged in 2014, a team of experts from the Ministry of Health, the World Health Organization, and U.S. Center for Disease Control and Prevention took a keen interest. A startling discovery was made about the Kamwenge elephantiasis strain. It is quite peculiar, and health experts refer to it as podoconiosis, non-filarial, non-worm transmitted elephantiasis. It has been established that the disease is caused by long-term contact with soils sullied with alkaline volcanic rock minerals such as silicon and aluminium. Scientists have established that exposure to the soils from digging without proper gear like gumboots or sandals predisposed people to the contaminated soils, leading to inflammation, resulting in lymphatic fibrosis, a soft and fatty growing swelling. This eventually leads to the swelling of tissues caused by an accumulation of protein-rich fluid that is usually drained through the body's lymphatic system. Prolonged foot exposure to volcanic soils is a risk factor for podoconiosis, the joint study by experts from the World Health Organization, Ministry of Health, and the U.S. Center for Disease Control concluded. But across these remote areas, the common myth is that the disease is caused by elephant dung mixed with the soils on which they till.
We held meetings, many meetings, where the community thought that it was witchcraft. Others thought it was because of elephant dung, until they collided with the UWA. UWA came in to prove if it was because of elephants from the park. Because people used to say that whenever they come for crop raiding, then for the dung they left, they live in our gardens, may be the cause of elephantiasis.
That elephantiasis, the disease coming from the mixed up together with the soil and the feces of the elephant. So that's what I know. And the second thing is, here in our village, when you go to garden to dig without gumboots, you may not get that disease instantly or that very day. But with time, slowly, you will have to get that disease because it is mixed up with the soil. So it has been there since until it cannot go away unless we have changed the place from here to another place.
Last September, Prime Minister Robin Anabanja, accompanied by a team of experts from the Ministry of Health, rushed guns blazing to the affected villages after the district woman member of parliament raised the matter on the floor of parliament. But this could barely assuage the pain of this community. The Kamwenge district woman member of parliament, Sylvia Bahireira, put the death toll to over 200 since the disease struck.
Not yet all that much done something significant, but it has been trying. We have been trying. First of all, there is not any causative organism. This is not a pathogenic condition. It is caused by minerals. World Health Organization has been here. Center for Disease Control, I think, also was here to investigate. Blood samples were taken off, but there is no any causative microorganism that was found. It's not like the other swollen limbs that is called elephantiasis, which is caused by a filarial worm. No, this is podoconiosis caused by accumulation of lithium, and silicon into the body system.
Bahireira says the plight of her people has been pushed to the back burners.
The government and the Ministry of Health to do for us is to have a treatment policy. This condition should be taken up by the Ministry of Health as one of the neglected tropical diseases. And we have a treatment policy incorporated in the neglected tropical diseases guidelines of Uganda, so that we have a clear budget and a treatment lane for this condition. Because it is silent, people are dying silently, we have around 700 to 1,000 people affected.
And no one who cares for them. No, even post-mortem taken for them. Here I'm sure, even the DHO, if you can ask him, they just die because they are very weak. Any disease that attacks them, they die anyhow. So they are advised to use some materials which they can't get because they are very poor. To use the salt, to use the soap, to use the bandages, to use the jerry cans every time to time, to wash themselves 3 times a day. Comparing it to their income, they can't afford this unless if they are supported.
In 2019, Vincent Mwesige, the principal laboratory technologist at Mbarara University, undertook more research into the antigen prevalence and risk factors of the elephantiasis strain currently only known to exist in Kamwenge.
That's like I said, they say maybe they were bewitched, maybe it is the danger of elephants. For me now, the research I'm looking at is to look at the genetics. What makes me prone to elephantiasis, not any other person? Because you find in a family, we have 4 people who have elephantiasis. 1 person has elephantiasis and the 3 they don't have. So I think it is an issue of genetics we need to look at, and then we enhance sensitization, look at the foot care and footwear. And also not neglecting the filarial part. Remember we said mosquitoes also are equally responsible here.
He said more emphasis is required, especially on sensitization, to prioritize primary health care.
For those who already have the disease, how can we protect them not to leave them to die? Because if you look at some of these clients or patients already diseased with elephantiasis, the feet are always either oozing, they are having sores or wounds, so they need care. And then also looked at footwear for both who are diseased and not diseased. Why? Because as you keep on exposing these wounds or sores in those soils, you can develop secondary bacterial and fungal infections.
So this condition comes very gradually, and it is caused by direct intact with soils over time. So that means that to avoid it, people have to reduce the duration of direct contact with soil. That means that they have to dig in gumboots. Then when they leave gardens, they have to have some sandals to use after bathing. And we have to encourage personal hygiene.
The possible factors for the spread of the disease, the study noted, is largely attributed to farmers who are barefooted while tending their gardens. It was established that farmers do not wash their feet after tilling the land. Like Alex Jeter said, perhaps it's high time the sympathy translated into some concrete action.
With this disease, we are not talking about that one. It's all about when we saw them coming here, after getting them on the ground, we start thinking about if he can give me 10,000, then I go for in a bar to take some beer, to take some alcohol. When he can give me beans or rice, something to eat, instead of talking about the problem that has brought that people here, we just talk about something different to put in our stomach or to drink only. But if we had talked about the real problem and the cause, we had maybe you never know got a medicine or something to cure us.
For those living with the disease, there's little that can be done other than access to soap and other detergents for constant cleaning of their wounds and integrating elephantiasis care into available care offered at surrounding health centers. The other concrete action, which government might frown upon because it has budgetary implication, could be relocating all residents to other parts and designate the affected villages as part of the national park. But without long-term solutions in sight, locals here have lost hope as this tropical disease continues to stalk this land, leaving a trail of death and despair.